Thanks, Gene. All right. 10 thoughts in 10 minutes about lean and healthcare. First, about me. For what it's worth, opinions are my own, your mileage may vary, and most importantly, I'm a recovering healthcare bureaucrat, not a doctor, not a clinician, not anybody that ever treated anybody, so I'm one of the dreaded suits. And as everybody in healthcare knows, if they could kill all the suits, everything would work a lot better. I'm one of those guys. Thought number one, the patient's not the customer. When I first got to the hospital that I ran in Boston, one of the big Boston teaching hospitals, it was a big place, medium big. 50,000, 60,000 hospital admissions a year, 50 or 60,000 emergency room visits a year, 750,000 walk-in ambulatory visits a year, so medium-sized big. But we really had 5 entities that paid the bills. Blue Cross Blue Shield, Harvard Pilgrim, Medicare, the insurance companies, right? The insurance, we live in a society where everyone has health insurance. Most of our patients have health insurance through their employer. In my hospital, about half of them had it through the government, but those are the people that pay the bills and therefore, to a large degree, define the value. The system's really, really broken. You probably already know all of this if you're either an employee or an employer or you have anything. Everybody touches the healthcare system. Forgive me, I'm going to actually show you a little bit of data. And all you really need to be able to see is that column with the American flag over on the right-hand side of the screen. There's a number at the top that says overall ranking, number 11 out of 11. These are the OECD countries. These are the rich countries in the world that have developed economies, have money to spend on healthcare for their citizens. And another way to look at the same sort of data set, a little bit easier to read graphically, in that lower right quadrant where you don't want to be of low performance and high cost, that's the United States of America. I think I stole this phrase, no improvement without payment reform, shamelessly from my friend, Dr. John Toussaint. So what does that mean? Well, the way that I think about, I don't want to delve into the arcane business of healthcare payment. The way I think about it is if you were, I learned some concepts when I used to be in the construction industry, things like lump sum and cost plus and time and materials, right? The way to think about that in healthcare is almost everything in healthcare is time and materials and sometimes cost plus. Now we're trying to shift to a lump sum system, but that's for another day. One good metaphor to use is if you were a homeowner and you were going to hire a carpenter to build you a doghouse, and you agreed to pay that carpenter for every board and every swing of the hammer and every nail, what do you think you'd end up with? Probably the largest doghouse in the world, okay? This is what we have in the American healthcare system, the largest doghouse in the world. Healthcare is a tapeworm inside the US economy, so says the smart guys from Berkshire Hathaway, Amazon, JP Morgan Chase, who just came together a few weeks ago to announce a new healthcare venture. We don't know what they're going to do exactly. Big announcement, obviously very big, very, very capable companies. They haven't really given us a lot of detail about what their intentions are, but what does it mean to say it's a tapeworm inside the healthcare economy? Well, my own revelation in this regard, I used to have a little bit of involvement as a citizen in my town government, and one of the things that I learned was that the healthcare budget for the town employees was eating virtually every available discretionary dollar in the town budget. My state in Massachusetts a number of years ago passed a new initiative to funnel more state aid to municipalities to pay for public education. More than 100% of those available dollars for education got eaten by the cost of providing for health care insurance for the town's employees. So it's a tapeworm inside, it's eating the American economy. Another way to think about it, wage growth. We heard a little bit about it this morning from Jim and from others. We all know that wage growth in the United States of America has been at or below inflation for 20 years or so. And yet, if you look at it in another way, the total cost of employment has actually risen quite sharply. What's the difference between the total cost of employment and actual wage growth? Employer-sponsored health care. A hospital is a relic of the era of mass production. One of the things that I learned about my hospital in Boston was about 70% of the patients admitted to the hospital at my place were non-tertiary level of care. What does that mean? There's primary care at your doctor's office, secondary care that happens in a community hospital. My hospital was a pretty fancy place, tertiary and quaternary, very sophisticated care for the sickest patients, and yet 70% of the patients that were in our beds actually could have had their conditions treated effectively at a much less expensive hospital somewhere else in the region, okay? But we built a system based on cross-subsidization. There's a lot of batching. There's no transparency of flow. We actually worked very hard and with some success to understand what was the flow of patients through our facility. But like a factory, before anyone has tried to lean it, it's not immediately apparent. Technology will not save us, in my opinion. There's a lot of other opinions, but we just got done in this country spending $40 or $50 billion in rolling out a national electronic healthcare record, mandating it for hospitals and clinical providers. That effort is pretty much done at this point. I'm not a sophisticated healthcare IT guy. I'm sure it brings a lot of value. It certainly has imposed an operational burden on hospitals. Is it going to help us understand work process and how to make it more transparent, leaner, and efficient? In my opinion, it will not. These records are fundamentally billing records designed to document the encounter of the patient with the system so that an audit trail can be established for billing and collections purposes. It's a regulatory process. We've struggled a lot because these different systems don't talk to each other all that effectively, so it's not going to be an effective tool for greater efficiency. The hospital is the largest employer in most congressional districts in the United States of America. And I mention that because any effort to substantially change and improve our system is going to have to deal with the politics of bringing change to a system that touches every congressional district. The first thing you will hear from every hospital executive in the United States, if you talk about serious reform to the way the system operates, is how many nurses would you like me to lay off? Missing the triple aim. I'm a big fan of the Institute for Healthcare Improvement. My friend Dr. Don Berwick, they originated this concept of the triple aim that all healthcare providers in the United States ought to aim for. Number one, better outcomes. That means when you go to the doctor, you ought to be treated well and have a good outcome as an individual. That's number one. Number two, better health and wellness for the population as a whole. Less chronic disease, less obesity, less diabetes, and the various sorts of burdens of public health. Number three, lower per capita cost, okay? Well, these are wonderful goals. How are we doing? Well, on the patient outcome business, the literature is conflicting. There's not really any great clarity, but we seem to kill somewhere between 100,000 and 300,000 patients a year from medical error in our system of care. This places healthcare, I think, about number three as a cause of death in this country. Heart disease, cancer, healthcare, maybe cancer, heart disease, and healthcare. It's somewhere up there, okay? By the way, I don't think this is a national US problem. I think this is probably global, right? So we're not doing all that well on effectiveness. We basically don't do population health and wellness in the United States of America. We treat at the individual level. There's not a robust system, and if you look at our population health and wellness, not anywhere as good as other countries. So per capita cost, well, there we are actually twice as expensive as any other system of care in the world. Every system is perfectly designed to yield the result you see, we read. So what is this system designed to do? It's actually the most effective system in the world in moving wealth from the nation, the taxpayers, and the patients into the stakeholders in the healthcare delivery system. Last message, wonderful people in a broken system. It's very difficult to go into any healthcare provider organization and not meet hundreds of people who care deeply about the patient, who came because they had a mission to care for the patient. Our task in helping these people understand their systems and improving them is to provide the opportunity for these wonderful people to do what brought them to healthcare in the first place, which is to alleviate human suffering caused by disease. Thanks very much.